Okay, perfect. So my name is Barbara Pais. I will be leading the webinar today with you. First of all, I would like to thank you all for joining us today. And we will be starting in 5 minutes, so at 2 p.m. But in the meantime, I will kindly ask you to fill up the form that will appear on your screen. This is only for EUROPARC internal information. Thank you very much.
I'm not panicking. I was really disconsolate.
Okay, hello to all participants who have just joined us now. Please, before we start, in 1 minute, just fill the form that is in your screen right now, and we will be starting soon. Thank you very much for your answers, and welcome everyone. I see people from Turkey, from Portugal, from all over Europe. So today we will start our webinar about natural benefits, nature, health and protected areas. I hope you all enjoy and have a good time with us today. This is the second EUROPARC webinar. The first one, we focused on Natura 2000 management, and this month we will be focusing on nature and health. Before we start, I just want to give you a quick overview about the EUROPARC Federation. We are the Federation of Protected Areas, and we represent thousands of protected areas from all over Europe. And we do it so by representing national parks, regional and nature parks, marine protected areas, urban and peri-urban parks. And we provide tools to protected area professionals for better managing their work on a daily basis. So today we bring you some interesting case studies from our network, and I hope you have fun and enjoy the information that we'll be sharing. So we will start today with an expert view from Pete Procliffe from the Scottish Natural Heritage. He will be introducing us the subject, and then he will introduce our two case study presenters that come from Scotland and from France. After that, we will have a final discussion. I have a question from Diarmuid. The presentation will be available afterwards. I hope you can hear me well. Maybe you can tell me if you can hear me well. Okay. Important information during the webinar. Our webinar will last around 1 hour and 15 minutes. And throughout the webinar, you can please write your questions on the chat box on the right side. And all the questions will be answered in the final discussion. So please write Melissa or Bridget to whom you are addressing your question and write it on the chat box. And tomorrow, all presentations and also the recording of this webinar will be available on EUROPARC website. So we now start. I will give the floor to Pete Procliffe. Pete Procliffe is a manager of People and Places unit at the Scottish Natural Heritage, also the EUROPARC Federation, and he is involved in the development of the new Commission of EUROPARC on health and protected areas. So Pete, please, I give you the floor.
Thank you, Barbara. I'm just waiting for my presentation to come up. Well, good afternoon, everyone. Delighted to see so much interest in the webinar, which bodes well for the EUROPARC Federation Commission on this topic, which Barbara mentioned, which we have our first meeting of tomorrow. I'll speak about that in a moment. But first, a quick overview of this broad topic. The important role of green exercise has been recognised for a very long time in conservation thinking. Indeed, it was very much part of the early thinking from the likes of John Muir, a very famous Scot, who was one of the founders of modern thinking about conservation and national parks. This quote is nearly 100 years at the bottom of the slide, 100 years old now, and the language perhaps reflects that, but the point is well made. Moreover, we know from practical experience in the projects that go on throughout Europe's protected areas that the experience of green exercise activity can make a big difference to the health of individuals, as these two quotes indicate. And the latter of those two quotes actually suggests another reason for this activity, a more cost-effective approach than conventional treatments. Here's a much more modern take, the first quote being from a UK Chief Medical Officer in 2010. The quote refers to the wonder drug or miracle drug that physical activity is. Clearly, physical activity can be undertaken in many settings, but we know that the outdoors is really important, both in terms of the numbers of people engaged, but also the quality of that engagement. The growth in physical activity levels in Scotland over the last 2 years is largely due to recreational walking, not taking part in sport or active travel. There's an academic equation on the front page, at the bottom of this slide. This was front page in the Metro magazine in Scotland in about 2015. While I doubt for maths in the equation, the factors considered provide some insight into why the outdoors is such an asset for health. So O equals the outdoors, N equals nature, S equals social interaction, CPM, childhood, summer memories and positive thoughts, T equals temperature, quite an important thing sometimes for us in Scotland, and AG equals holiday excitement. I hope this more complex looking diagram will be familiar to some of you at least. It's from the Millennium Ecosystem Assessment, which is a UN's assessment of the state of the world's ecosystems. In the UK, we have completed a similar assessment for the 4 countries. The left-hand side is our natural environment, biodiversity, landscapes, green space, etc., and the services it provides. The right-hand side, the constituents of human well-being. The assessment identifies 4 types of services: supporting, provisioning, regulating, and cultural. This leads to tangible benefits in terms of security, materials, health, social relations, and ultimately freedom of choice and action, all the ingredients of a good life provided by our natural world. This framework takes a global perspective. So in developed countries, we largely take clean water, air, and food supply for granted, and we are relatively free from fires and flooding. However, today in most European countries, there are strong links between cultural services, recreation, aesthetics, spirituality, and health. This has been further developed in various reports, and here's the most recent one from IEP, which lists all the benefits, all the known benefits of the natural world in terms of human health. All good stuff, and I've highlighted in green the ones which are about positive environmental goods, benefits that come from physical activity in contact with nature, rather than the negative or environmental bads that come from things like flooding or pollution. The focus of our work in the commission will be on environmental goods. There is a huge amount now of evidence out there in terms of the benefits that nature provides us in terms of human health. And I've listed the 4 main areas here on this slide. The first area is just about improved health. So we know a brisk 30-minute walk on 5 days of a week can reduce heart attack and strokes by 20 to 30%, diabetes by 30 to 40%, hip fractures by up to 70%, bowel cancer by 30%, breast cancer by 20%, depression, dementia by 30%. So it has amazing qualities. Physical activity and outdoors and contact with nature can also help protect us from future stresses and aid mental concentration. Just being outdoors during the day can bring benefits in terms of mental and physical health and help people guard against illnesses. It can also support effective recovery. The environment has been known to have restorative qualities, and this can promote recovery from physical stresses. There's also some famous research simply looking at the benefits to recovery from major surgery of looking out of a hospital window at green space rather than brown or grey space. And we also know quite a lot about the wider health and social benefits of the outdoors. Public use of nature is associated with wider social health and well-being benefits. More people connecting with their local green spaces and being involved in its care can lead to stronger, more inclusive and sustainable communities. And finally, we also have quite a lot of research evidence around young people and sustained benefits, particularly in inspiring young people below the age of 10 can actually motivate them throughout their lives to enjoy the outdoors. As well as the medical evidence, there's actually a lot of social evidence or social survey evidence here. And I've just presented here the results from our national survey of people's attitudes and behaviours to the outdoors. I think the 2 I'd probably highlight, as well as the physical and mental health ones, are about good social experience and being closer to nature. And these provide a lot of the added value of being outdoors that, say, being in a gym or swimming lanes in a swimming pool can't provide. This is a long-standing agenda, but it's taken more shape in recent times by the health promoting Healthy Parks work, which started in Australia and has been further developed by IUCN. In Scotland and other parts of the UK, we've developed the concept of a natural health service, which focuses much more on the benefits to people of healthy parks, rather than healthy parks themselves. And Bridget will talk about this work in a moment. And the EUROPARC Federation itself has already led work to bring together some of the good practice from across its members and across Europe through an initial commission. This produced a series of 9 case studies, which are available on the EUROPARC Federation website, with coverage from UK, Scotland, Wales, France, Spain, Portugal, Latvia, Finland and Spain. The Commission also produced draft resources pack or toolkit, but it was never published. In terms of issues and opportunities which we might want to think about during this webinar, I've listed 4 here. I think the first thing to say is around positive policy convergence that exists around health issues, around pressures on budgets, public sector, about the preventative spend agenda, where we think about preventing people becoming ill rather than just treating them when they are ill, and around public health concerns. From our experience in Scotland, we know that working with the health sector itself is challenging. It's a big sector, complicated, and talks a different language to us. So we need time and effort to learn to work together. There is an issue, I think, about mismatch between target groups and the types of people who sometimes come and enjoy protected areas. This underlines the importance of outreach activity that many protected areas are undertaking, and also the need to develop tailored approaches depending on the type of protected area that you are and where you are located in relation to cities and towns. And I think the final opportunity to draw on is actually there's a lot of good practice out there. There's many protected areas doing work around health benefits which we can tap into and learn from. And finally, just to word about the new commission, this is a slide summarising what we think will be the main areas of focus, about the role of protected areas, completion of the toolkit that I mentioned, and developing a European version of Healthy People, Healthy Parks guidelines as well, and a few other things listed here. I'll certainly be interested to have any comments or questions about the Commission, which, as I say, meets tomorrow. There are many ways to get involved. The Commission itself has to be small to keep it fit for purpose. But if you're interested in this topic, join the wider email group. We'll be having a workshop at the annual meeting in Portugal this year that EUROPARC has. We'll be updating the website, and hopefully about this time next year we'll have a series of products that I'll just talk about, hopefully another webinar to talk about. Okay, I've gone very quickly, and I'm now going to introduce Melissa, who's going to give a case study from her regional park experience in northern France. So hopefully the technology will work. I'm going to switch my microphone off.
Yeah, I think you hear me. I try to speak correctly. I would like to present ENRX before to begin, and after to present some example from ENRX and the regional park of Nord-Pas-de-Calais. So in this structure, I'm a project manager in charge of outdoor sports, but also Europe mission and also patronage and the partnership with the private sector. So who is ENRX? Just a brief introduction to present ENRX. ENRX, where are we? We are in the north of the France, and it's a new region because it's a merger between two regions, Nord-Pas-de-Calais and Picardy, and the new name is Hauts-de-France. This this region, it's in this region, there are 5 regional nature parks, and before with the Nord-Pas-de-Calais region, we have only 3 regional parks. So just to present who is ENRX, the acronym of Espaces Naturels Régionaux. It's like a regional committee of the parks of Nord-Pas-de-Calais and Hauts-de-France. And we have also a regional conservatory to protect and to promote regional species and regional vegetables and also different animals. So I can't add a definition about regional nature park, but you can't. Did you hear me? I see the different remarks. I ask to speak.
We can hear you well, Melissa.
Okay.
Yes, we can hear you well. You can go on. Thank you.
So I continue. So about the definition on regional natural parks, you have the official definition, and it just to prove that it's a protected area. It's just that's the regional level. So the main aim is to sustain the regional environment, and we have a strategy with the regional council to advance in this aspect. So I would like to present 3 parks of Nord-Pas-de-Calais, and we have some picture to imagine this 3 parks of the north of France. So Parc Naturel Régional de l'Avesnois, second is Parc Naturel Régional Cap et Marais d'Opale. It's 2 aspects. The first, it's an aspect with the coast, with the sea, and the second, marshlands. We have also the different species figures. And the third, it's Parc Naturel Régional, the first of France, first regional park. And it's between different big cities, so you have an important pressure, urban pressure on this natural park. So why we decide to work this aspect? Because we have a regional study from the Ministry of Sports, and this national ministry has a different regional offices, and with the regional offices of the north of the France, we do a regional study to define who is the people who is sports and in the regional territory. So you have some numbers, some results on the link between sport activities and health, and because 60% take part in sport activities for a reason in link with health and well-being. So there are different definitions to have a link between outdoor activities, nature, and health, because we decide to work on these 3 aspects, 3 network, and we are different people with leisure people, organizers, facilitators also, with different visitors, families, and it's different people and participants in the park, and different visitors, inhabitants, but also visitors in the park. So when we decide to work in this aspect, the link between sport, nature, and health, we have different objectives defined by a group, collective group, with the 3 parks, and also different partners and stakeholders. The First aim is to have a new way to discover nature, and it's also to have a new network with these three networks: sport, nature, and health, and to have communication. So for these people who doesn't practice sport activism. So different objectives are to raise awareness, and in particularly awareness owners, and to have more dialogue, because I will present just after the agreement with the Gilles de France network. And after, to increase well-being, how is it possible to have more well-being, and just to discover this well-being concept? How it's possible to move, to breathe, and to discover in another way the protected areas. So, what's the results and outcomes? We decide to advance in some action and to create some actions. The first is to create a challenge between nature and health. For this challenge, we are in agreement with an institute with different experts of well-being, medicine, and sports, and also in insurance, to encourage people, inhabitants, to move to trees and protected areas. So the objective is to move more, and with a daily objective of number of steps, and to move of number of time to have an activities every day. So it's a preventive approach, and it's like a little game to encourage participants. So it's a first action. The second, we decide to have an agreement with Gilles de France, with the owners. Gilles de France is like a network of different owners, and these owners are engaged and different for this label, and engaged for quality, and engaged in protected areas, particularly with Gîtes Panda. So we propose to some owners to have e-bikes to discover the territory in another way, and for example, to go to encourage also local producers, and to buy with in these local producers. So to encourage also accessibility and to move more in protected areas, we would like to propose this action to move for everybody. So we propose a Joelette. It's a special bike proposed, and you can see in the different photo. It's possible for people, from a man or a woman who is not able to move on just by himself or herself with this bike. So we have another action with a training. We decide to have a network of ambassadors, because for me it's not possible to it's not possible, and it's more difficult to exchange directly with inhabitants. So we decide to have some ambassadors, and after to diffuse a message to move and race in the protected areas and in a park. So we organize a training for these ambassadors, and during this training, it's 2 days of training with two approaches. So first, it's a nature approach with a nature facilitators, a colleague of the park, and the second, it's a mix between these two approaches. And the second, it's with a fitness coach, but in nature and adapted to a nature. So these ambassadors, who are these ambassadors? It's different operators, tourism and sport operators, and different other owners, also association managers. We have different participators. So we have a little book for these trainers and to share their experiences with other ambassadors. It's an experiences, and after this training, we decide to propose an experiences between a local association and also this two coach, fitness coach and nature coach, and to propose to a small group of vulnerable people from this local association to have this double approaches with sport, health, well-being, and also nature, biodiversity aspect. So it's proposed, it's during from this spring to September, and it's proposed to June, not September. September it's evaluation, and we propose to move in protected areas and to discover in the same time the nature with different little exercise. So how we do to propose these different actions? To begin, to try to know more this about this subject, better about this different network, we propose 2 info days. So first, it's to know and to have these different natures to discuss and to explain that we do that an expert of health propose, that a coach facilitators, nature facilitators propose also to try to know more. So first, it was the first day, and in the second day, the aim was to exchange, but after to exchange, to build together, and it's a try we propose after an experiences, training ambassadors and an experiences, local experiences. It's the next just after this info day. So I said that it was difficult to encourage directly the inhabitants, and it's more easy to have facilitators with ambassadors. And for these ambassadors, we propose different communication tools with exhibition, for example, and with different book, magazine. So Le Sport, c'est dans ma nature. It's the sport is in my nature, in the protected areas. And we decided to participate to a fair, a regional fair, and with Belgium also, with English people, English visitors, and the main aim is to share experiences and to propose experiences because it's very nice to have experiences in a protected areas. It's to encourage and to promote these experiences. And we have an important agreement, important partnership by an agreement with Gilles de France, this network of rural and urban cottage, and an agreement with WWF by Gilles de France, because some owners decide to have double approach with Gilles de France and WWF, the NGO, famous NGO experts in not biodiversity but nature. So it's particular owners with a specific approach of nature. So these owners, I said you that we propose e-bags, but we propose also label, well-being label, So we propose to promote nature, to become ambassadors, and to give some tools, but also to do together some action, nature action. It's directly the ambassadors. This level, fitness, nature, and well-being level, the aim is to discover the nature and the biodiversity by outdoor and outdoor activity. So it's an approach directly for the visitor who would like to move or to move on another way in a protected areas. So just to aim some recommendation about learned lessons, why work with different partners and not directly with inhabitants. I think it's to work together, it's to go further. It's so necessary to involve elected people to decide together and to have a concrete action. And I would work with inhabitants, involving ambassadors, and in training ambassadors. What are the impacts? It's difficult to quantify, but it's as explained Pete in the introduction, some studies present and promote these benefits. So we think that it's really important to have an exchange between these different nature, because it's more richer. And just to as conclusion, some perspectives. We would like to promote protected areas and in particularly parks by prescription, to have a direct link with medicine. But it's a new way to think with this prescription, and to prove by experiences that the nature for people. So we would like to continue and to adapt these first experiences of coaching with a double approach, nature with a nature facilitators and fitness coach. So it's 3 perspectives that we would like to do with the parks, regional parks of Nord-Pas-de-Calais. Thank you for your attention. I hope that it was not perfect, but enough to understand that we do.
Thank you, Melissa. It was great and really interesting to see how your work has developed in the last few years as well. Thanks. Okay, we're getting a good list of questions, which we'll pick up at the after the next case study.
I didn't follow I present, but after.
Okay, so we'll just move on to our last case study, and then we'll start picking up the questions. As Barbara has asked, if you have a specific question, then please direct it at someone. It'll just help the logistics of the question session at the end. So I'll now hand over to my colleague Bridget, who's going to talk about our work.
Hello to everybody. I am going to present a case study at a different scale to Melissa's. The title slide introduces Scotland's Outdoors, our Natural Health Service, and this indicates the fact that we're working to ensure that the health benefits of engaging in the outdoors are spread right the way across Scotland. So just to introduce Scottish Natural Heritage, we are a government agency. We were created by legislation and we are funded by the Scottish Government. Our remit is threefold: nature conservation, landscape enhancement and improvement, and also engaging with the public, encouraging and increasing public enjoyment and understanding. We have many roles. We are a key environmental organisation in Scotland. In some of our roles, we advise government and other organisations with regard to policy development about all sorts of environmental issues. And we also own and manage a number of Scotland's national nature reserves. Health is an increasingly interesting topic for SNH, and it is very much a high profile and high priority issue within SNH's corporate strategy. So, to introduce the work that we are doing currently in Scotland. Scotland has great outdoor resources for recreation, volunteering and outdoor learning, as well as the general rights of access that were created in 2003 under progressive access legislation in Scotland. We also have many managed resources. Those include places and path networks, and information is obviously very important, and we have a range of organisations across the public and the voluntary sector which support the public in using the outdoors. They provide very much a welcome to those more managed places, and providing managed places enables people to grow in confidence in using the outdoors. Our environmental resources are extremely important and are currently underutilised in terms of contributing to the health agenda. As Pete has already said, evidence is very much growing about the benefits of the outdoors for health, and we are very much working to promote the contribution that the outdoors can make to Scotland's key health issues, which are primarily physical inactivity, mental health problems, and very importantly, health inequalities. So, how are we working to make more use of our outdoor resource to deliver health outcomes? Just in terms of I guess, some principles and brief background of the situation in Scotland. We're very lucky, perhaps being a small nation is advantageous, but we are very lucky to have a robust cross-sectoral policy framework which recognises the links between the environment and a range of physical, mental and social health benefits. And within this policy framework, there are many recommendations for more use of the outdoors for health benefits. The links between environment and health benefits are backed up by strong published research, and these links feature across many government policy areas in Scotland and are also echoed by voluntary sector organisations across health and environment too. Some brief examples of our policy framework include Within planning, there are a number of important green infrastructure projects, and the links and the benefits to health are very much recognised as a key objective of investing in green infrastructure. Within transport, we see active travel and using our environmental assets as delivering on the health agenda. Education, we have an education strategy that encourages taking learning outdoors. In terms of health, there is a current focus on physical activity for health, and there is recognition of the value of more use of the natural environment. And even Scotland's biodiversity strategy, there is a reference to the development of a natural health service. And we are beginning to make good progress in terms of developing the concept of using the outdoors as a natural health service. So since last year, since 2016, SNH has very much been championing the concept of the environment as our natural health service. This diagram is how we are trying to represent this concept, and starting from the bottom, we're very much building on, as I've said, our environmental resources as the foundation of health promotion and health improvement. And then moving up the diagram, these three pillars represent a range of green exercise activity from everyday use of the outdoors in terms of recreation or active travel, and then in the middle, health promotion initiatives, which encourage people to engage in the outdoors. Some examples here include health walk groups, which are certainly raising their profile within the UK. And moving on to a range of health interventions, which are designed programs that are specifically to help people with defined health or social needs. So in that extent of green exercise activity, we're showing that more engagement in the outdoors and use of nature-based solutions can contribute to both public health and social care delivery, and especially if the activity is targeted at those whose health would benefit the most. To make the most of nature-based solutions, we need essentially two things. We need to sustain and improve the resource. We need to increase public participation, and we need also to connect better with the health sector. And these are three themes that have helped us develop an action programme in Scotland to develop the use of our natural health service to support and also to complement our national health service, which is provided by the government across the UK. So, three themes which have helped us to develop an action programme with partners from the middle of last year. I will briefly describe the content of our action programme, which essentially has 7 work streams. And on this slide, I'm showing you 4 that are planned to deliver outputs at national level. I'll not go through them in detail, but you can see the themes that we're following. Fundamentally, we need to raise awareness of the benefits of green exercise, and we need to improve links between the environment and the health sector. So we are beginning to work very much with partners to develop these 4 national work streams. But the action programme is also wanting to test approaches at a local level, and we are working up 3 interventions which we will be supporting at local level in a selected number of locations, because our funding won't stretch to funding everything everywhere. The 3 interventions, I won't say very much about the first one. This is all about adding to a green infrastructure strategic intervention project that we are currently having funded by the ERDF in Scotland. The next one is a green space intervention, where we're planning to engage with, we are already, engaging with 4 NHS area health boards, and we have, through partnerships with environmental organisations, set up 4 local pilots to activate greater use of those hospital green spaces, whether it's through garden projects, through environmental conservation and management work, or, and in particular, promoting the use of the outdoors as therapeutic space. 2 of the 4 sites that we're working with are in fact psychiatric hospitals. So essentially, these interventions are aiming at activating more use of the outdoors in terms of treatment and recovery, and in terms of hospital green space, very much engaging with patients and staff, and also the surrounding local community. The 3rd intervention that I'm going to speak slightly more in detail about is developing what we're calling local green health partnerships. And the action programme, in the action programme, we're aiming to support 5 partnerships, and these essentially will bring together area health boards, local authorities, leisure trusts, national environmental organisations, and also environmental and health organisations at the local level. The key purpose of bringing these groups of people together into a partnership grouping is so that developing green exercise at this quite large area, large scale level, will ensure that the work plans that come out of these partnerships respond very much to local health and social care priorities. And I've listed here some of the activities that we expect the partnerships to look at. But essentially, it's all about raising awareness of green exercise assets, and by assets I mean not just places but organisations and activity programmes as well. It's all about coordinating better access to information, that's accessed by the public and also by health practitioners. And it's very much about connecting healthcare processes and pathways, these established mechanisms within our health delivery service, and connect those to green exercise options. And we very strongly believe that there is added value to be had by this kind of partnership approach, which allows a focused cross-sector partnership at, as I say, a local authority or an area health board scale. Currently, we have one partnership pretty much up and running and in operation, and we are in discussion with 3 or 4 others that are wanting to engage in this intervention. So we have scoped out what we feel we can achieve with the Natural Health Service Action Programme. I won't talk to all the detail in this slide, but essentially, we're recognising that our natural natural environment is an underutilised health resource, and in Scotland we're promoting a holistic approach, looking at accessible places, which can include protected areas, and using those places as part of people's lifestyles. We're funding national work streams, as I've mentioned, and these local interventions with partners, but we're also happy to see the concept picked up elsewhere so that others can contribute to delivering the concept of the outdoors as our natural health service. So the measures of success are very much centred around, again, raising awareness of the principles and the policies and the opportunities, and very much about coordination and integration between sectors. The aim being to make green exercise mainstream. So finally, 17-18 will, as I say, be the first full year of building up momentum in terms of new delivery under the banner of our Natural Health Service in Scotland. And in terms of next steps, we are working to develop these national and local partnerships. We are seeking more funding from key national partners, and we hope Scottish Government. We're preparing a range of communications materials and briefings, and we are very much working hard to turn our ambition into action. Thank you very much. And here's a web link where to the SNH website where you can find some more information.
Thank you very much, Bridget. And thank you for everyone who's been typing in questions. I think I have 9 potentially questions to go through now in this final bit of the webinar. I should say thank you for everyone who's also been sharing information and case studies. I particularly have liked the FOE IEP pamphlet that Robbie referred to, which was published last week, I think, around health inequalities and nature. I think that's particularly helpful for us because there is concern that the outdoors is just for the middle class and the healthy. Well, actually, it's got even more to offer from those suffering poor health or from disadvantaged backgrounds. So that's really helpful, and as Barbara says, we'll record all those. So we're now going to try and do questions, and I'll answer some of them, and then I'll probably pass to Bridget to answer others, and come to Melissa last but not least to answer others as well. So let's see how this goes. So I think Paul kicked us off with how do we make the outdoors more relevant to creaking public health bodies? And I haven't looked recently about the state of public health bodies across Europe, but certainly in the UK, it's frontline news about the state of these bodies and their budgets. So I think I would say, from a Scottish perspective, 3 things. One of which Bridget has talked about in terms of influencing or creating this cross-sector policy framework. It's been the thing that really kicked that off in Scotland was what we call our National Performance Framework, where the government set itself a number of strategic objectives, one of which was about a healthier Scotland and one was about green Scotland. And that allowed much greater alignment between the different parts of government. I'd also say that you need to work with the willing. There are people in the health sector who are very passionate about this agenda, and can make things happen, and finding those people is really important. And the third area, which I think Bridget's already talked about, is actually creating space to demonstrate these things. So if you can create projects which allow demonstration projects or pilot projects which allow you to test this approach and show that it works to health practitioners, I think that's where we have made progress. and particularly around the NHS green space work which it talked about. Gaia asked about citizen science approaches, and perhaps I failed to define green exercise at the beginning. I did that partly deliberately because it's a very broad church for us. It's to do with activity outdoors which involves contact with nature in a very broad sense. So yes, citizen science can be part of the green exercise agenda. I think where we start from with citizen science, at least in Scotland, is a long tradition around collecting data for nature conservation purposes. And that has been a preoccupation. But increasingly, we're looking at citizen science initiatives, and there's one in the Cairngorms at the moment about photo posts, which they're encouraging the community to use and take photographs of images through the seasons, through the years, where actually you could be much more creative about using citizen science to provide health benefits. I think there's probably research that's been done in the UK around citizen science which shows health benefits arising from citizen science activities. So definitely a rich form for some protected areas to take around green exercise. Robbie then asked, what should we do what should decision makers be doing to promote nature and health benefits? I think one of the things we've worked on quite hard in Scotland at the moment is around just establishing a common set of key messages and products around green health and green exercise activity. Simply having a common language that the environment sector can talk to the health sector about shouldn't be understated. So I think we've put a lot of effort into developing those key messages, evidence-based where we can, and products. So I think that's the thing I'll probably highlight there. Paul also asked a question of Melissa, which we'll come to in a moment. When Paul Hambling asked about cross-sector policy framework to Bridget, I think I've sort of answered that. But I think I'll just probably add a thing. One of the important partnerships that I think might happen in England is around our relationship with one of the national health boards in Scotland, NHS Health Scotland, which is the closest we've got at the moment to a public health board. But actually, it was working with that board which opened up avenues into the other 14 health boards that we have in Scotland. Actually, it's more than that, but we certainly have a large number of health boards. I think that's it in terms of the questions I was going to answer. I've got another couple of questions which have come in. Bridget, so the questions that I had identified for you, one was from Corinne about access to jobs in natural health service work. And I guess what she's teasing out there is the sort of private, public, third sector type activity that goes on in Scotland.
Yes, well, I think we certainly do have a reasonable workforce within the public sector, environment agencies, local authorities, green space staff, rangers, access staff, and voluntary sector organisations who are probably leading the way in terms of staff engaged specifically to deliver green exercise projects and programs. Sometimes there's a danger of talking perhaps to politicians and saying, look, there are some fantastic examples out there. We don't want the response to be, oh well, if it's already being delivered, then why are you asking for more support? But we need to use those good examples carefully, and we need to raise understanding of specifically the public health benefits that are being delivered by often poorly funded voluntary sector organisations, and encourage additional funding to come broadly from the health sector and create more jobs that can support green exercise interventions delivering on health and social care.
Okay, thank you, Bridget. I guess one of the interesting challenges for EUROPARC is working across a whole variety of different health systems that we have in Europe. So I think I emphasised the point about tailored solutions. So you really need to find solutions which work for you in your context of your health sector. Another question for Bridget about monitoring and evaluation. So there's a general one about how do we know if we're successful, which I think you touched upon, and then a more detailed one from Lynn about baseline information about green space use and health.
I think we're most advanced in terms of the NHS green space projects that we're working on. So I mentioned 4 specific hospital locations, and we have, through voluntary sector host organisations, employed coordinator staff to work at these 4 hospital locations. And before they have really started activating greater use of the NHS green space by patient and staff and the surrounding community, we've done a baseline survey of usage, and we have also done an initial survey of staff in terms of their awareness of that resource, their current use, whether it's for their leisure time, their breaks, their lunch breaks, or whether it's part of their work day and using those spaces with patients, and then having developed engagement programs that will actively and formally assist greater use of the NHS green space. We've gone back in and repeated those 2 surveys, and are certainly getting very positive results about how attitudes are changing. And I think culture within the UK's NHS is very much a key issue that we've recognised, and it will take time to shift the culture of our health delivery service from a culture of curing people when they're broken to working more on prevention and healthy lifestyles.
Okay, thank you, Bridget. I see Baptiste and Lynn are both typing, so you've stimulated some discussion. Final question for you, Bridget, before I turn to Melissa. We've just had a question in from Marif. Apologies if I've mispronounced your name. About this age-old concern about encouraging enjoyment and use of nature and damages nature. So, how do we tackle that?
Carrying capacity and sustainable use, and areas that are robust and fit for purpose. I think what we are emphasising is that, yes, I talked about legislation which does give the public access to the vast majority of land and inland water in Scotland. So yes, the parks and the gardens and the nature reserves are important assets, but actually, if this is about encouraging people to make lifestyle choices and make use of the outdoor environment as part of their daily or weekly routines, then it's about spreading the load. It's about making use of literally their local green space, whether they whether they live in in urban centres or in urban fringe areas, there are a plethora of just informal green spaces, whether it's a piece of woodland, whether it's a riverside path, even in a town, then that's the kind of everyday resource that I think is what we're aiming at, instead of perhaps pointing them at the more vulnerable locations.
Okay, so a managed approach, and I think one which takes resources, and I guess that's one of the reasons that we have protected areas. So, Melissa, I'm going to hand the mic over to you, but first I'm just going to ask the questions that I think people are wanting to know from you. So, Robbie asked a specific question about how we reach health or groups with health issues in our work. And I'm thinking of your case study.
Can you repeat the end?
Yep, how to reach groups with health issues rather than necessarily the healthy and the sporty already. So how do we target our outreach work to reach groups with health inequalities? And also the two questions that Bridget's just answered, one about how do we know we're successful, so what sort of monitoring and evaluation is going on in your parks, and the final one about the conflict sometimes between, how do you manage a conflict between conservation and public enjoyment. So I'll hand over to you, and then once you've finished, I think Barbara will pick up unless there are any other questions.
Melissa, we can hear you yet?
The sound on the yes from
Okay.
minutes I didn't hear anything, so it was French. Excuse me. So I didn't hear the sentence or the last question. I hear the evaluation, but not after. Oh, no sound.
Hi Melissa, I'll just repeat the three questions. So one was about
yes.
How we target health in groups with health inequalities. One was about monitoring and evaluation, and the final one was about managing conflicts between conservation and use of the outdoors.
Yes, to have a balance between conservation and development. Yes, so, and after evaluation, it's the question. I don't hear you.
Okay, please, I'll ask you, Pete, can you just type down shortly on the chat box so that Melissa can answer? And in the meantime, I will move forward for some information that I have to give you. Let's just wait until Pete types down just the topics, and Melissa can then prepare herself to answer. I would just like to inform you that we will have our next webinar on the 25th of April. This time we'll be looking at tourism, especially tourism across borders. So we'll have members from our TransParkNet meeting, our network of transboundary protected areas, and they will be talking about how are they managing tourism across borders. They will be giving us very interesting examples. All the information will be available in the coming weeks, but you can already save the date in your agenda, the 25th of April at 15. Okay.
In June, for the next in June, you have information?
I couldn't understand you, Melissa, sorry.
In June, Pete says that in an email that we continue the exchange in June. It's not
I couldn't understand. But anyway, for the questions that were not answered, we will chat with Melissa afterwards, and we'll be providing you the answers tomorrow in the web article with all the presentations available and also with the recording of this seminar. Before we leave, I would also like to give you a tip that Mary just suggested. There are also relevant case studies available on IUCN Panorama Solutions. It's worth to take a look at. And more information produced by the EUROPARC Commission on Health and Protected Areas will be also available soon. Okay, a final call. You can follow us on our social media and on our website. We have plenty of information available for protected areas to support your daily work. And before you leave, I will just ask you to please answer this very brief poll that will appear in your screen right now. It's just your opinion about the webinar and some inputs that you would like to give us for future webinars. Thank you very, very much to Pete, to Bridget, and to Melissa. You were all great, and I believe you gave a very interesting contribution to all participants. Thank you all to all the participants and their interesting questions. You really made our discussion relevant. And I hope to see you again in the next EUROPARC webinar. Thank you very much. And please just give me some inputs in our poll. Thank you.